Hi, today it's my very pleasure to have as a guest on Unpain Clinic podcast, Busi Musiwai, as a founder of Babuebaby.
Right on.
And yes. So it's interesting how things work in the world and how when you put things out there, how you connect with people. And we met based on synchronicity, right?
Yes, yes,
About 6 weeks ago. 6 weeks
it
ago.
was.
Yeah,
Yeah.
6 weeks ago. So you like, how did you ended up at Unpain Clinic?
It's so weird because I didn't plan to be in this in on this floor at all. I was
Y-
headed to the second floor where my orthodontist is,
Yes.
and I got lost. Never been lost in this building. Been coming here for like 2 years, and ended up getting lost. And I ended up on this floor. Then I kind of peeked through. Then I see the nice decor. Then I notice on the door it says "Unpain Clinic." I'm like, "Unpain? Okay, let me check you out because I live for pain. I live to serve others that experience pain all the time. And if there's anything out there that can help, my people, my clients, the people I serve, my community, I'm like, let me get in there and just check it out. so, so when I walked in, who did I meet at the reception?
It was Carmen, and yeah,
It was
Carmen was working.
Carmen that
Yes,
day that was at the reception.
yes,
And the weird thing is that I'm talking to Carmen and I mentioned that I am Busi from Babuebaby and
yeah,
I want to know what you guys are all about. And then she goes, "Well, I know about you because
yes,
we have a mutual friend."
yes.
So that got me so excited. Then she brought you into the conversation and we
Yes.
started talking. And
Yes, yeah.
yeah.
And I found out that you're OT, occupational therapist, and
Right on.
you
Yeah.
had your expertise, and then we start chatting about, our entrepreneurial expertise.
Yeah.
And that's where you told me about your product, how you're actually started, and how you're helping, moms to carry their kids easier. So can you tell me a
Yeah.
little bit about you like, yeah,
The
your
product
creation?
itself. Yeah, absolutely. I was born and raised in Zimbabwe where baby wearing is really practiced like from a very young age. And I knew about, comfortable baby carriers, just comfortable carrying itself. In Africa,
Yes.
we use the wraps and everything. So after my graduating from OT and practicing as an OT and doing a lot of positioning, I just realized that the market didn't have something that was as comfortable as I experienced in Africa, and I wanted to bring that. So think of Babuebaby as a marriage of the African heritage of baby wearing
Yes.
and my heritage here. So my two cultures kind of all marry together, my Western
Yes.
culture and my
Yes.
African culture. I just married them, the two of them in this career, and that just that's a labor of love, really, because it ended up taking. I didn't think that the design and everything was going to take that long, but I didn't
Yes.
want to compromise on. I wanted to make sure that I'm bringing out a product that's truly designed by an OT and by
Yes.
someone that has that rich African heritage of baby wearing. I wanted that to reflect in the carriers themselves. So it ended up taking about 6 years. I would say 6 to 7 years, really.
Well,
But here we
well,
are, and we finally
yes.
launched after all those years, and we have a patent in place, and we're filing more patents because we're coming up with more designs. So
Yes.
yeah, yeah.
Yeah. And your product is designed to help moms. So when they're carrying uh, their baby, to the way to be distributed equally, so it doesn't actually, hurt them more and make it
No,
harder for
it
them. Correct?
doesn't. So yeah, so you will find even the patent itself. Our product is the only product that are actually designed to offload weight from the
Yes.
shoulders and have that weight distributed around the torso and around the hips. And that for the simple reason that we know that a shoulder joint is not a weight bearing joint, really.
Yes.
It's
Yes.
actually the hip, which is the weight bearing joint. And we wanted to capitalize on the hip. And that's why
Yes.
the design is, and it's also, yeah, so basically not just moms who run.
Yes.
It would be like moms, dads, any caregiver really. Like
Yes.
we are
Yes.
trying to
Yes.
support even the grandparents
Yes.
in the in this parenting journey, because it does take a village to raise our children,
Yeah.
and that's pretty much where we're coming from. And you will also find that it is the only carrier on the market that's actually designed with the special needs community in mind.
Yes.
Um, we did a very extensive research, and we did a lot of focus groups with the special needs community. They embraced us, and they really wanted a product that was also designed for them to be able to carry their children, especially children with low trunk muscle tone
Yes.
or low neck muscle tone. So they get, you know, floppy. That's the word that the parents have been
Yes.
using, that,
Yes.
my
Yes. Yes.
child is very floppy. But, when you put them in a carrier, most of the time they are leaning to the side, or,
Yeah.
they're not comfortable in the carrier. So the design of the carrier is actually meant for the wearer themselves, and and for the child.
Yes.
Yeah.
Yes. 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 And honestly, that's why I said synchronicity, because you were telling me about amazing product and how you're trying to help moms, and I was at the same frequency myself. Is we have been treating C-sections for
Yeah.
so
Yeah.
long, and I said, oh my god, this is where we finally found somebody that from OT perspective is thinking
Yes.
about like how the weight is distributed to be comfortable for caregivers, moms and dads, and making more comfortable for the kid as well, right?
Absolutely. Absolutely. I've had two sections, C-sections myself.
I
And
know, I know.
hearing you through that conversation, how you have this passion really to serve this group of, like, this community, it really touched my heart, because with C-section, it almost feels like you go on this journey that other people really don't understand. And
Yes.
you mentioned something to me that day, actually, that I kept thinking about and I kept reflecting on, because it just gave me so much joy to hear. Because I mentioned something about, well, I've had two C-sections, and now I have this back pain. And I mentioned something about, well, with aging, I'm kind of getting used to that pain. Then you said, no, actually, no, Busi. That pain, you don't have to get used to it. And it's not an aging thing. And then I'm like, oh my goodness. I had been preaching this for a very long time, us meeting together and talking about these issues, the back pain. Uh, it's not just an aging issue. Arthritis
Yes.
is not just an aging issue. Actually, it can happen to anybody. And
Yes.
but you mentioned that, hey, with Shockwave, when you were talking about your company, with Shockwave, we can take care of that. And you got my attention right there, because I'm like, as women that have experienced C-section, or one C-section or two C-sections, whatever it is, to have something that can take care of the stuff that actually impact us. So our
Yes.
joints get impacted, our muscles get impacted, and we go through a lot. And most of the time, as caregivers, we deny ourselves. We focus on, the family, on our babies, on our kids,
Yes.
and raising the family itself. Then we deny ourselves of, things that we actually, we need to be taken care of
I
as
know, I
well.
know, I
So
know.
yeah, so that's amazing that you ended up inviting me, and you were like,
Yes.
how about I take care of you, and this clinic,
Yes.
we take care of you,
Yeah.
and through Shockwave, and see how that goes for
Yes.
C-section. And
Yeah.
yeah, amazing.
So I want to kind of go back because yeah, like I truly appreciate again your time coming here and sharing your personal story. And this is what we want to do is like our goal is to help every single mom who had a C-section and they end up in, chronic lower back pain, neck pain, and they have no clue that one of the reason of their chronic pain, it's actually coming because they had a C-section, or like any abdominal surgery. And I have created, the protocol where we can actually reset the muscles. So when I told you that, yeah, your C-section is the reason why the core is not engaging, what was your thought? Like, what did you think about
Hmm.
about
You
that?
know that I didn't believe you right away,
Yes.
but but I was open-minded because I mean I live for this, and I also realized that as a as a caregiver, as a parent, and as a healthcare professional, sometimes it's so easy to forget yourself. And
Yes.
I know that I am guilty of that. I know that after I had, my two C-sections, I went back to, taking care of my family. I went back to work and I went back to, creating Babuebaby. But I totally denied myself. I totally forgot about myself. So when you mentioned that we can take care of that, I was like, well, there's a lot of people out there that have so much pain, and
Yes.
including myself, and people that a lot of people, and you're claiming that you
Yes.
can take care of my pain that I've lived with for what, 15 years?
Yes. Yes.
And
So
so I
yeah.
didn't believe you at the time. I said it outright. I'm like, but I said I'll be interested to hear more and to
Yes.
learn more about it. So I'll come
Yes.
back. I said,
Yeah,
yeah,
so remember the first time, so for 15 years you had pain on the neck, upper shoulder. You have been active person, you're not somebody that you do nothing. So
yeah,
like you have a very strong muscles, you go for long walks and all that. So you have done a lot of things, right?
yeah, yeah,
Yes,
yeah,
yeah.
yeah.
So remember, if you can recall the first session when I took the testing, the balance, pushing you around, and then I asked you to hold your legs against gravity. Uh, what did you feel at that moment? Because you're super young, you're strong, and then you could not hold your legs against gravity.
That
What was
shocked
your,
me.
yeah?
Yeah, that really shocked me because I've always been, I mean, always been active, and I just recently stopped running.
Yeah.
But I still take my, my 10K walk pretty much every day, whether it's winter or not. Like I still do that. That's still important to me. But that day really shocked me because it was almost like it exposed me in a way that because I didn't know that, my balance was off.
Yes.
I, as an OT, I work with a lot of people that have, impacted balance, and I know how to assess for it, but never assessed myself. And that was
Yes.
my first assessment on balance, and that really shocked me. It
Yes.
did.
Yeah.
Yeah,
Yeah. Yeah. And then we treated the C-section with shockwave,
yeah.
and then right after that, what
Was
happened?
minutes after that, we
Yes.
went back to the same exercise.
Yes.
So it was the same kind of, and I was, man, again, that shocked me
Yes.
because then seeing the improvement in balance, and you trying to even move me, and even just against gravity, how
Yes.
stronger I was within minutes, literally
Yes.
minutes. That
Yeah.
really shocked me because, but it kind of validated what you were saying about,
Yes.
hey, I
Yeah.
can
Yeah.
treat you. But it was my first time that I could actually trust in your treatment, because it was right within seconds. I hadn't left the clinic where I could be like, well, kind of got a little bit stronger over the week.
Yeah.
It was actually within seconds. Was it like 10,
10
10
minutes.
minutes?
Yes.
10
Yes. Yes.
minutes. Yeah,
10
it was
minutes
10 minutes.
treatment. And we just treated the C-section. And
Yeah,
then we retested you on like when you came back second, third session. So it was even a couple weeks later that
it was.
it did
It
not
was.
change. And that's actually when I try to explain people that sometimes we all are born with our normal strength.
Mhm.
The problem is not just muscle weakness, it's actually the communication. So when you cut the skin, you cut the sensors of that area, your nervous system loses communication with the core
Fascia.
region. with the
Right on.
fascia start pulling, so you start compensating with other body parts.
I
And
did a lot
that's,
of that.
yeah, and that's how you, if I say, if you're dysfunctional doing nothing, you're still going to be dysfunctional when you do something. And
Yeah.
usually moms, first time moms, when they have a C-section, they're experiencing, to have another person to care for the first time in their life. They're not really paying attention to their body. They're just kind of putting a lot of work. And then 2-3 years later, they end up in this chronic vicious cycle of lower back pain, neck pain. Depends what they do with their body. Because I do have, for example, that I've seen moms that, they love running, and they try, to kind of get back in shape after the baby and after the C-section. They start running and they end up with a lot of plantar fascia Achilles injuries, because when the core doesn't support the body, it's extremities suffer. So everything else suffers. So I remember when you came first, after the first session, when you came back, can you do you remember, can you recall, like, how did you feel the next day, and like couple days after that, like what did your body went through?
Oh my goodness. And I'm so thankful because you kind of warned me. You mentioned
Yes.
right there that you may actually experience more pain than usual for the next 3 days. Oh man. So the following day, I remember just experiencing so much pain. And because you had given me treatment pretty much from my lower extremities and
Yeah.
up to I think it was up to the C-section area.
Yes. Yeah. So,
Yeah, yeah,
so
yeah.
just scars. Like we just
Yeah,
treated
that's just the
scars that day.
scars.
Yes.
And I
Yes.
had gallbladder removed as well. So you
Yes.
kind of
Yes.
touched on that.
Yeah.
And I remember experiencing this pain, and I almost picked up my phone to call you on your cell. And then
Yeah.
I'm like, you know what? For the first time as an OT, I need to experience what my clients experience, but I also wanted to pay attention to the pain and
Yes.
how that was providing some healing, because I could tell that usually I would compensate. You mentioned that actually during the assessment, that you tend to compensate around here,
Yes.
just around the diaphragm and like just around this area here, this region. And I remember experiencing so much pain around there, and I was paying attention to it. There was some pain around the axilla, then
Yes.
around the diaphragm, but it wasn't it was very painful, but it wasn't something that I needed to contact you
Yes.
for, or
Yes. Yes.
even call an ambulance for. But
Yes.
I could tell that my body was starting to process. And you had mentioned that with all the trauma you went through, I
Yes.
mean, things are going to start happening, and like you're going to feel that lightheadedness. And I remember
Yes.
standing we're having coffee, my husband and I was kind of standing by the island, and I started experiencing this lightheadedness. It wasn't lightheadedness in terms of dizzy, but
Yes.
my body just started feeling light.
Yes.
And I said to him, I said, well, I ate, I'm fine, I had coffee, but I feel very light. Then I went back to what our conversation the day before. I'm like, oh, that's happening right now. And I had mentioned to you actually during the treatment that I feel free, but in a very weird way. And it's almost like I said, it's almost like you give me like a mint, sort of like,
Yes.
I don't know how to explain these guys. I mean, it sounds weird right now, but I felt so light, and I still can't describe how that lightedness, like I can't describe what it is, like what it is that was, but I felt very light. So yeah, that
Yeah.
was just so weird. But I'm so glad you warned me and you explained to
Yes.
me what I was going to experience kind of throughout this journey. It was almost like a journey that I was holding so much to this trauma, all the pain that I've been through, all the C-sections. I mean, both C-sections and that other surgery that
Yes.
I had had, and just seeing that all kind of getting lifted out of my body
Yes.
and
Yes.
experiencing that. Yeah, and some of that compensation was just around this region and around my shoulders as well, and starting to
Yes.
feel that uh lifting. That was amazing. Yeah,
Yeah.
it
And
had
and the
light,
reason,
by the
yeah.
way.
Yeah. So and the reason why that happened is because once your inner body start communicating properly, now you're using the proper muscles, even just challenging gravity, just standing in one place, and your center of gravity, the center of balance shifts.
It
That's why you
shifted.
temporarily, feel off. And now
Yeah,
all those muscles that have been compensating, they start let go. That's why you feel kind of that, when you said like almost like mint, that freshness.
that's
Yeah. And
freshness. Right on.
yeah, and I remember you telling me when you went for your same walk and carrying your backpack, you did not have that back tension.
No, I didn't. I didn't. That surprised me again because I usually take this long walk, but part of that walk I go kind of past this little hill that I have,
Yes.
and every time, most of the time I carry my backpack when I go for these long walks, and on this particular day I was wearing the backpack. Then it surprised me as I just kind of went up that hill and I didn't experience any tension, any pain. And most of the time, my pressure point was around here. I would say maybe
Yes.
C5, C7, around there. And I
Yes.
would experience some pressure points there. And on this particular day, it didn't happen. So again, that was another confirmation that hey, I was onto something, and I shouldn't discredit you right away because
It's
but something was happening to my body. Something was
yeah.
actually happening to my body, and I was starting to actually feel normal, which felt so weird because I had gone for so long, feeling um this pain, back pain, and it got me so excited because it just kind of spoke for what we believe in with Babuebaby when we talk about taking care of our joints. So it's no longer about taking care of your joints and the pain. It's
Yes.
about taking care of the joints and being pain free as well. It got me
Yeah.
so excited at that time, especially yeah, for anybody that has had C-section for sure.
I know, I know. See, this is a so how scars actually affect human body and motor function. This has been known for extremely long time, and I had actually personal experience with scars. When I was 5 years old, I had a hernia surgery, and I was a competitor swimmer, cyclist, and I could never understand why I'm super built on my extremities, but I always had a bigger belly. And then once I actually learned in neurokinetic therapy, muscle testing, that surgical scars doesn't matter how old they are because obviously you still live in the same body.
You are?
so so it affects you. So I treated myself, I noticed a change myself, and then I start testing, on people. And now as a clinic, it's been about 7 years that we focus completely just on scar treatment. We target that first. Now every single person that ends up with chronic pain, they have had some kind of a surgery that is affecting what we call it the sensory input, how the brain is actually perceiving information, and how it responds back. And every single client that goes through that, they go similar to your experience. That's why we warn people. It's like, say, hey, you might feel actually big shifting in the body. Even though we just treat the
Absolutely.
scar, you might feel like
Yeah.
other body parts moving and shifting, but also you can actually experience some emotional, almost like discharge, because human body is not really meant to be cut. Thanks God that we have surgeons out there to save lives.
Yeah.
But then after surgery, like everything needs to heal, back, and the body wants to communicate back as before. Sometimes it can because of the scar tissues, adhesions, and multiple things. So therefore, it goes in that compensation mode, and then you go with life. Life is busy. You don't really feel and listen to your body. So yeah, yeah.
No, that was amazing. As healthcare professionals, we are pretty much trained to take care of others,
Yes,
and we
true.
don't know how to take care of ourselves. I think this was the first time, in the longest time, where I've felt like I'm really being taken care of, and in a way that I would like to take care of others. Like that was the first time in like how many years, seriously,
Yes, yes.
that I got this I go to your team, especially
Yes.
you, to actually be able to take care of me. Yeah,
Yeah.
yeah. And I think honestly, we all need that. We just don't do that for ourselves. E- Especially moms.
Yes. Yes. Yeah.
Moms. I don't know why we're wired to just serve others without thinking about ourselves for the most part. And that needs um I think that needs to stop because
Honestly, yes.
it really does a lot of damage to us. We need to be taken care of as well. We do.
Exactly. Exactly. First, as a mom, you're creating another human. You're giving all the nutrition, all the
Yeah.
energy,
Hmm.
all the power to create this
Yeah.
human. Then you have to take care of them, and that never stops. When they're little, you have to take. I have 3 kids, so I know what my wife goes through,
Yeah. Yeah.
and it is the hardest job in the world.
It
So
is.
I
Yes.
am extremely humbled and happy to have another person like you, that you have done something to help moms, to support, to make their life easier, because a happy mom, it means happy family,
Yeah. Happy
kids,
home.
husband, everything, right? So that's why whatever you're doing, with your creation, to make it comfortable, for caregivers of any kid. And then us here, just like we just fill a missing link, if they had a C-section or any surgery, we can help there, or any pain. And then those two kind of go
They
together.
go
So
well together. That
yes.
honestly got me so excited how I ended up here
Yeah.
in this clinic. I'd never heard about you. I mean, with all my pain, I had never heard about you. Then to end up just walking in here at the time that I actually my soul really needed this, not
Yes.
just as an entrepreneur or the founder of Babuebaby, but
Yeah.
as a parent, as a
Yes.
woman who experienced who went through who had C-sections. I I needed you, and I am so grateful because if it wasn't for that experience, I would have just gone for 15 more years
Yes.
without
Yes.
taking care of
Yes.
myself. And
Yes.
that makes me so sad because now that I have this, it makes me so sad to know that I could have just gone for another 15 years or more without even
Mhm.
thinking about myself and the wounds that I carry, right? And the
Yes.
trauma
Yes.
that came from that. So yeah, absolutely.
Honestly, Busi, it's like, this is the thing, is I see clients, 6 years old, 7 years old, and they had moms that had C-sections in the past.
Yeah.
And when they end up seeing us, they usually have tried everything else. And the
Yeah.
reason why nothing else kind of helped is because the problem wasn't on the muscles. The problem was more kind of on the software of the body. So even at that time, even after 34 years, I still go and do the same thing, because
Mhm.
that was what was missing in the body.
Mhm.
And but anything new is very hard, to put it out there. And we can talk all day trying to write it and explain it, until you're here and experience it yourself. It's
Yeah.
very hard to explain it.
It is hard to explain. That's why I was kind of mumble jumbling there because I'm like, I experienced something, like something just lifted off my shoulders. It wasn't just the pain itself, but there was something more to it. And
Yes.
it's so hard to explain, honestly, you guys, but that happened to me. And just to add on to what you were saying about the mom and taking care of the whole family structure without even thinking more about ourselves. The body is supposed to heal, and we don't have that village, especially here in our Western culture. Not many people have a village to take care of them right after they have had a
Exactly.
C-section or given birth, and most of the time we're on our own, really. And I mean, we're thankful now that there are doulas out there that are starting
Yes.
to be helpful. There's like baby wearing educators that are feeling that role. But when I had my kids, I didn't have that village. It was just
Yes.
Owen and I, and
Yes. Yes. Yeah.
it was hard. It was hard, but then you do life. You go
Exactly.
on. You do what you need
Exactly.
to do, and I think. so I'm grateful that, I ended up having people to take care of me. Well, 15 years,
Yes.
it took 15 years for me to actually have a village to take care of me. But hey, I'm grateful for that. I mean, yeah, yeah.
It's amazing. I know it's a natural process, but I'm actually from Kosovo originally, and I remember as a kid, like our tradition before, if somebody gave birth, they would actually put them in a room for 6 weeks, and then they
Yes,
would like feed them,
them.
prepare, like, yeah, and say it's like stay there. You cannot
Yeah,
move for 6 weeks. Allow your
yeah.
body, to like fully
To
restore.
heal. That was like me growing up right there.
Yes, yeah, exactly.
Yeah,
But this is kind of the problem of as a humans, our biology has not evolved. We are still the same as hundred
we
thousand years
are
ago, but our lifestyle have has evolved
changed.
so much
Yeah,
that it's very hard, to keep up because our cells are still the same. Our cells are still craving, everything natural from
right
food,
on. Yeah.
from activity,
Mhm.
from everything. So we are part of this, good evolution. It's a human upgrade, I think.
Yeah.
But then when you go through any change, you suffer,
It's
and
tough.
that's gonna happen. But it's pushing, people like you, like me, like so many other, people that wants to make the easier for, for moms and kids, to create things so we can actually make this transition, this process easier.
Better.
Better, yes, yeah, yeah,
Yeah.
yeah, exactly, exactly. Um, yeah, Lucy. So again, I thank you very much for coming in today, for doing this,
Thank
for
you.
sharing this personal experience, with other moms. Our personal goal as an Unpain Clinic is we want to try to actually treat moms that had C-section 6 weeks after the C-section.
Yeah.
That's kind of the soonest because that will prevent a lot of compensation, a lot of injuries
Yeah.
that is not necessary to for them to go through. Um, so many people ask like why you don't go and talk, to a medical doctor or educate, surgeons. I've tried to educate my wife's, gynecologist, and she just thought that I'm kind of asking for clients. It's like, no, I'm not asking for clients. Like we
No,
actually support,
it's
we
more than
want to
that.
educate
Yeah.
you. So whoever you do C-section, just tell it. It's like, hey, if you end up with this, there's one therapy, one place that actually can help. So
That's
yeah,
important. Nobody told me with my C-sections, as big as those surgeries are, nobody told me about the fascia and the just the trauma that it goes through and how
yes,
it impacts our bodies. Um, and I went through, I mean, we learned that in OT, but
yes,
then when it comes to yourself, for some reason, because you don't have other people taking care of yourself, I
yes,
think focus
yeah,
on your clients and everything. But I'm so grateful that maybe there'll be someone out there that can actually get this message that it does get through a lot of trauma. I mean, our muscles, our ligaments, our
yes,
soft
yes,
tissue, including the fascia, and that does impact how we do things. I mean, I stopped running. Why?
yes.
I loved running, but it got to a point where I was like, so I'm actually starting to get back to it now,
Yeah,
that I've gone
that's
through my
awesome.
treatments.
That's
But
awesome.
I had stopped. I had stopped because, I just went back to walking more than running because
Yes,
it was
yes,
impacting me. And
yeah.
yeah. Mhm.
When the body cannot fix something, it tries to actually adapt and compensate and like kind of learn, new things so it can
Get
still,
related. Yeah.
yes,
Yeah.
move on. And yeah. Okay,
Yeah.
Busi. So we're gonna close it for today. Again, I truly appreciate your message, your experience. You're gonna help now even more people. You're already doing that, but now you're gonna
Thank
help them
you.
another level. You have such an amazing, heart and a very positive person. Like our very, new connection and
Oh yeah.
relationship that we just literally met recently. It's been amazing. So
Yeah, thank you. Thank you for having me. And I look forward to doing more of these. And next time when I come back, I won't be a patient. I'll be an
yes,
OT and
yes,
educating
yes,
us
yeah, yeah,
alongside you. So I'm
yes.
excited about that.
Yeah, we already talked to, we're gonna start, so you're going away, I'm going away, taking, summer break. So when we come back in September, our goal is together to actually start probably going to communities and just spreading the word that this is available. And then we'll fix, the internal body, and then you help them with like taking care of their
What a
kids.
better way of taking care of our community. Like, what a
Exactly.
better way. It gets me so excited. My heart is full just knowing that we'll be in this room with these moms and
Yes,
serving them. And
yes,
it's so funny that I am at that stage where I'm craving serving others because my kids are older. They don't need me much. I mean, they're not, but they don't need me as much as they did when they were little. So 9
yes,
years and 15 years, and I am craving being part of that village for other
yes.
moms. So I am so excited about this because it gets me to be part of many women's village
Yes,
when
yes,
when we serve them together. So that's exciting
exactly,
for sure.
exactly, exactly.
Yeah, thank you. Thank you
Okay,
so
thank
much.
you very
Yeah,
much.
take
It was a
care.
great pleasure. See you.
Bye.
Bye.